Well, let's go ahead and get started. I'm Shelia Cotton. I'm at Clemson University, and I was asked to do an overview of my research and then to help facilitate a discussion. Can you all see the PowerPoint screen? Okay, let's get the slideshow going. Great, and I apologize, I have 3 monitors, so I'm not quite sure where I should be looking, but if I'm turning away from you, I apologize. So I'm a sociologist by training. I study technology and health and well-being, and so the overview that I'm going to give you of my research today is really focused about technology and longevity. And as I said, I study technology use really across the life course, from the very young to the very old and everybody in between. Now, a lot of my research does focus on older adults specifically, and how can we help them to use technology to enhance their social connections, their health, their quality of life, workforce participation, and so forth. And all the work that I do focused on technology and quality of life, it's really about how can we use technology to improve people's lives? How can we solve problems in society more generally? And so I wanted to briefly just talk in very general terms about a few of the projects over the last several years or so that I thought you might find of interest. I study a range of emerging technologies and more traditional forms of technology too, and try to think about innovative ways to use those technologies to improve people's lives. So several years ago now, I was actually funded by the National Institute on Aging to do a large randomized controlled trial focused on using technology to enhance older adults' quality of life. So really basic technology, helping them to use computers and the internet. And so we developed this 8-week training program. We went into 20 assisted and independent living communities across within a 2-hour range of a mid-sized city in the deep south part of the United States, and really started with the very basics. How do you even turn on a device, to actually how do you really use it to communicate, to enhance your quality of life. Fantastic project. The participants loved it. And then we actually found some pretty good outcomes from that. It really helped to increase the quantity and the quality of communication and contact with social ties. It helped them to not miss seeing people in person as much, because they could communicate through using the internet. Saw some decreases in loneliness and depression, and we followed them over the course of a year after we actually did the training with them. So a very positive project, a huge project. We actually wrote a book about how do you go about designing technology for older adults in CCRC. So if anybody's interested in that, but it was based upon our experiences plus also best practices by others in the field too. So another project I want to briefly go over with you is just focusing on emerging technologies and older adults' willingness to actually use those technologies. And so with a former PhD student, Travis Cadillac, who's now a postdoc at Illinois, we did a large survey of older adults across the US, because there's a lot of potential for emerging technologies to help people age in place, to enhance their quality of life, maintain independence. You know, if you're focused on aging at all, you know a lot of this already, so I won't dig into the details. And 80% of older adults have at least one chronic health condition. Over 60% have 2 or more chronic health conditions. So there is potential to use technology to try to help either ameliorate the negative effects of those chronic conditions or to deter the onset of those chronic conditions. And so we focused on older adults' willingness to use 6 different emerging technologies, from autonomous vehicles, robots, internet connected home related products, and virtual reality, as we thought all those had potential for enhancing their quality of life. As I said, it was a large scale survey of older adults across the US, over 1,100 people. And what I'll just give you here is just a quick overview in terms of the descriptive results. Here you can see that the highest percentages were willing to use more smart home aspects of emerging technologies. So cameras for monitoring, internet connected home appliances, smart homes. They weren't very willing to think about using autonomous vehicles or virtual reality or even assistive robots in the future. So a lot of work that needs to be done in society if older adults are going to be willing to think about using these things in the current or in the future. So quick and dirty overview of that one. On to the third one and last one, a third out of the fourth that I want to tell you about. So with colleagues back at Michigan State, where I was prior to moving to Clemson a year ago, we did a lot of work with older adults looking at activity trackers and older adults' perceptions of those and what differentiated individuals, short-term versus long-term users. Physical activity is so critical for older adults. Well, it's critical for all of us, but for older adults in particular, for staving off those chronic diseases, for lessening the impacts of those chronic diseases. 84% of older adults don't get the recommended daily recommendation for exercise. And so we wondered, could activity trackers change that? 7% approximately of older adults use trackers. It depends slightly on the specific subsamples that you may be looking at. But most people, when they do start using them, they stop using them within 6 months. And so we did a series of focus groups. We did individual interviews. We did some surveys with individuals across the United States trying to answer these different questions. And I certainly don't have time in my 5 to 7 minutes overview to go into depth on this. We've got numerous papers published from all these studies that I'm talking about, and I'm happy to follow up with you afterwards if you want more info on some of these. But just kind of the short synopsis of some of those findings were that it really has to be an internal motivation. And so the challenge is, how do you get older adults to get that internal motivation to want to change their physical activity level and to perceive that they are capable of doing that. And then you have to have tailored resources that are really user-friendly for older adults to really encourage them to be able to use it effectively and to not stop using it over time. And so kind of takeaways from that, it has to be individualized goals and goal setting. You have to really help older adults to be able to form habits around wearing the activity trackers, following up, paying attention to the results, the steps that they're taking, that tailored training that I talked about just a moment ago, and helping them see how they can get creative with different activity opportunities is really important. And so, all right, there is no magic bullet. It's hard work. It takes really interdisciplinary teams to think about how you're going to go about helping older adults to be successful in changing behaviors. I mean, public health's been trying to do it for decades, but it really takes an interdisciplinary approach. Okay, last topic I'm going to cover, and I'm sorry I'm talking fast. I don't usually talk this fast, but limited time. I've increasingly over the last several years done a lot of work focused on socio mobility, we'll call it. So how people move about, how they get to where they need to be, particularly thinking about AVs, thinking about driver assistance, those types of things. And a lot of this work is focused on older adults and then individuals across the life course too. And so we know already from AARP that over 20% of older adults don't drive. And what this means, though, is that it has implications for their social engagement in society, with their social ties, with businesses. I mean, it impacts all across society. They go to the doctor less often. They don't get together at religious organizations or with families, all these things, which impact their mental health, their quality of life more generally. And so autonomous vehicles have a lot of potential in terms of helping to lessen some of that. Lots of benefits: mobility, enhancing independence, contact with those social ties, health, getting to doctor's appointments, those kinds of things. But What we know, though, is that there are lots of needs in terms of autonomous vehicles, in terms of simplified interfaces, training, support, cost is an issue, lots of these things that really are going to impact whether older adults are willing to be able or willing and able to use them in the future. And so part of a large-scale survey that I did with older adults across the US, you can see from the slide here, very few older adults would be willing to use an autonomous vehicle. And as you go up in age, it's even fewer of those older adults are willing to use autonomous vehicles in the future. If you look across the life course, you see there are some perceived benefits by the different cohorts across the life course, good for the environment, improved emergency potential, fewer crashes. But if you look at the blue and the orange, they're lower than these other cohorts. Concerns are higher among the older adults and the baby boomers, as you can see. System failure, security, being on the road with other vehicles, and potential expenses are all the major concerns for older adults. So what next? We're really at the beginning of trying to understand the impacts of AVs on society and on older adults in particular. As I said, there's a lot of potential for aging and disabilities populations to really enhance, try to potentially enhance their health, their mental health, their social connections by helping them to get out into the community. But there's also potential within the vehicle to help monitor some of these health aspects too. So you've got to change some of the communication and public perceptions around autonomous vehicles if they are going to be more pervasive and used more so by older adults in the US. And actually I have a large NSF grant right now focused on workforce impacts of autonomous vehicles that I won't really talk about today. So just quickly, technology is only a tool. It's really about how can you enhance people's connections, their quality of life, their health for the work that I do in terms of technology. So I'm sure I'm over the time, but I want to leave you with where will the future take us in terms of this. So it looks like somebody had a chat, Natasha had to jump off at 10. But so now I really want to turn it to, oops, hold on, get back here. To our questions for the discussion in our group today. And so it's hard for me to see with the Zoom, the way it's set up, who all is in the breakout room, but I'd like to have just some quick, like 30-second introductions of folks. And then I'd like for us to talk about what brought you to the session today. How do you see technology enhancing longevity? What are some of the barriers? And then anything else that y'all want to talk about this morning? All right, Susan, you want to go first?
Yeah, thanks for that, Shelia. That was a really nice overview. Yeah, so I'm here. I'm just interested in the work you're doing. I'm a new Zinc. I've just got some Zinc awarded sort of money. So just interested in your journey, and the topics obviously of interest as well. So, but at some point it'd be nice to probe you a little bit about how you've used the funding to help you get there, if you don't mind.
Sure. Yep. And let's do the introductions and then we'll come back and talk about some of those issues. No, that's great, Susan. Michelle, you want to go next? Well, you're with the National Academy, but you can introduce yourself.
Sure. Hi, everyone. Michelle Taplitz. I'm a program officer at the National Academy of Medicine, and I actually am the project director of the Healthy Longevity Global Competition. So thank you all so much for joining the summit, and congratulations to those of you who have received awards and for your interest in the competition. And I'm definitely a kind of social science oriented person, so I was very pleased to be able to join this conversation and hear more about Sheila's great work. So happy to be here.
Thanks, Michelle. John, you're showing up next on my screen.
Hi, Sheila. I messaged you earlier. I had a problem. Sorry I was late. I couldn't get on with Safari, so I had to get on to Chrome. But I'm a founder of a startup in Charlotte. We are using wearables to track individuals with dementias, trying to understand behavioral interventions for Alzheimer's and dementia. So, and I think you may have sat on a panel for our NIH review. I don't know. I've seen your name before, Yeah, that's we're trying to passively collect data, high frequency behavioral data from wearables to understand how we can change behaviors for the future and lower risk.
Great. And Nancy, you're showing up next on my screen.
Hi, Sheila. My name is Nancy Wexler. I'm a program officer with the John A. Hartford Foundation. Nice to be here today. Good to see you, Michelle. Great summit so far. So I joined this session. We actually are funding a portion of this whole program, the Healthy Longevity Competition through the National Academies. Michelle is our partner in this and in the Catalyst Award. And we are, we fund nationally to improve the care for older adults. So we're not typically in technology as much as sort of social interventions, medical care, and that sort of thing. But clearly, to have the biggest impact we can have, technology is really important, and innovation is really important. And we've seen some high tech and some low tech impactful things so far here. So I joined today just to understand better how we could simplify the use of technology, integrate it into daily life, and support some of the better care, better mobility. One of our frameworks is age-friendly health systems, which includes 4 M's, one of which is mobility. So thank you so much for this great discussion and these great innovations.
Great, thank you. Peter, you want to go next? Peter, you're on mute if you're listening. Maybe we'll come back to Peter. Srinivasa, I'll probably butchered your name. I'm very sorry. You want to go next?
I think he had sent a chat saying that he was having some challenges with the microphone. So I was trying to reconnect with another device. So he may not be
okay
there at the moment.
And then the only other person that's showing up for me is it Bowie? Would you like to go next? I'm not sure if other folks are having difficulty or not, but hopefully they will be able to chime in. So I'm going to encourage them to chime in. I'm actually going to stop sharing the screen now. I've got the questions that I can pull out for us. I'd much rather see y'all and have more of a discussion. Susan, you had asked about my journey and how funding has contributed. So funding definitely has contributed to my success over the years. And what I've told lots and lots of people over the years is that you start small and then you think about ways to build upon that. And so much of the work that I've done over my career has really started out with internal funding, usually from a department or a college where I was based, to help me get pilot data that then I could use to try to go to the National Science Foundation or the National Institutes of Health or USDA or other organizations to help fund bigger projects that are much more expensive. So for me, that's been kind of my path. Was there more specific questions that you had in terms of that?
It's more specifically to do with this program, the global initiative. I'm just wondering how they've supported you and how you've taken that resource, if at all.
Yeah, so not directly. I was actually asked to participate in another workshop that they did. I think it was over the summer or late spring. And then I've attended, several National Academies workshops over the years, more as an attendee. I did organize a workshop around technology and aging that the National Institute on Aging funded a couple of years ago. That was in conjunction with the National Academies also. But they haven't directly supported my own research per se. I would say that these experiences, though, both leading a workshop that NIA funded and then participating in, whether as just a participant or as a breakout session leader, have really helped though to contribute to enhancing my social network. I've met fantastic people that, we've had lots of follow-up conversations and even started some projects. So that part I think has been more beneficial for me personally than, giving me money specifically. How about others? Yes, Shavana, I'm sorry, how do you say your name?
Srinivasa Murthy.
I'm
Murthy
sorry, I butchered it.
like Murphy. No problem. I am a psychiatrist from Bangalore, India. Can you hear me?
Mm-hmm. Yes.
Okay. My special interest is in terms of how can we use spirituality as a way of fighting loneliness of old age. How can we make it, because India is a very, very spiritual country, and that is something, a resource which is there in the community. And we are working upon methods by which breaking down spirituality away from religion and making it an essential part of coming to terms with old age and loneliness. Specifically in India, we have a system called ashrama system. That is the brahmacharya, grahastha, vanaprastha. That means, after the age of 60, 65, you move away from the society inwards towards spirituality. I'll be happy to talk about that as we go along. So I'm looking forward to hear other people's ideas, particularly in the morning session, the award session. There were a number of people who talked about loneliness, mapping the things in the community, individual, personalized way. I think it's a very interesting possibility. Thank you very much.
Thank you. And I don't know if others have done work around spirit. I can't talk this morning. Spiritual. Okay, what he said. Have other people talked about loneliness and spiritual aspects and how those may be related together? I personally have not done work in that area, but I'd certainly love to hear if others have.
Can I develop it a little further if others would like to hear it?
Sure, I think it's fine if you want to, talk for a minute or two about your work.
Yeah, I will talk. See, one of the problems that happens when as you get older, you, as one of my patients said, you are downwards from the society. How do you find meaning, new meaning to the remaining life that you have in front of you? Obviously, it can't be from your physical health, it can't be from your professional life, but it has to be from the Indian point of view, from the spiritual world, And again, when you talk about the spiritual, most people think of it as some sort of some amorphous type of a thing. What we are saying is there are components to spirituality like gratitude, service, purpose of life, humor, accepting the larger force in the universe. And if we can operationalize it and make it possible for people to choose 1, 2, 3 of them as part of their end of life situation, the later life situation, we might be able to find both a solution and meaning to the things. That is what we are working upon.
That's great. I have done some work with older adults and mattering and how technology can contribute to a sense of mattering. So feeling like other people would miss you if you were gone, that you matter to other people. And one of the things that we've shown is that, technology use is certainly related to mattering but the pathway is that it's through helping older adults to feel connected to their social ties that really enhances the mattering. But I think all the issues that you mentioned are really important. As we all age every day, and we start to think about, or our perspective about what's important to us changes across the life course. As I have a 15-year-old daughter, what she focuses on as being important is very different than what I focus on, having been a professor and a parent and these different roles that I've had. So understanding the relevance, the importance for older adults as they move through the life course, and particularly at the end of the life course, I think is really important. So if if we go back to some of those questions that I had posed earlier, I am curious what brought all of you to this particular breakout room today, because it looked like they were fantastic choices. And I personally would have loved to have been in like 3 of the other ones too. But what led you to this particular one? John, you want to start?
Yeah, I think, first of all, I'd seen your name before and I see so many names, so I knew you're familiar, but the focus primarily on the use of wearables. I think in the segment that we're with, we're trying to understand how we can improve the wear adherence for older individuals. Particularly we're focused on individuals with dementias. And so some of these people may live by themselves or have a caregiver that sees them every day or, on occasion. So how do we get a person to wear a device so we can better collect information? We really believe that we need to be collecting data passively. Self-reporting is very difficult. So if we can get a person to wear a device every day, that'd be awesome. But we're also facing this challenge where, we believe that Apple builds a really good device, but for some families, and if we're talking about just the United States, there are socioeconomic challenges to that. There are also, people are in their ecosystems of Android and Apple. So we want to build something that's device agnostic, but we're a startup with limited funding. So we're starting with the Apple Watch, but that also has a battery drain of roughly a day and a half. So there's a trade-off. So, so at the end of the day, I came here because we're talking about wearables, we're talking about health, we're talking about longevity, and that's what I live, eat, and breathe every day. Sorry, I could talk to you and everybody, every day about this.
And I'm happy, as I said earlier, to continue the conversation after today too. If anybody wants to follow up with me, please feel free to do so. I'm curious if a couple of the folks who weren't able to talk earlier, Peter or Bowie, and then we have Paul, who looks like just joined us. If y'all want to introduce yourselves, if you are able to. I'm not sure. We've had some mic issues earlier, but if anybody's open or available, interested, please feel free to chime in.
Hello there. Sorry for the technical issues. My name's Pete Jones. I'm a lecturer in an optometry department in City University of London. And in answer to your question, why I joined this session, I can't actually remember. I think I just picked one at random, but it just looked good. But because I missed the start of this and I missed everyone doing their introductions. But I was quite glad I did join. I think what struck me and what I was quite interested by were when you were presenting the data suggesting that older people were not necessarily particularly enthused by a lot of the kind of high-tech gadgets that a lot of people like myself spend a lot of time developing. And I think that very much fits with what we've found anecdotally as well. And I think that there's a massive disconnect between a lot of the things that people are saying, and particularly things that people are publishing, and the reality. And there's a lot of stuff being pushed out there, particularly in my field, which is vision. VR tests for this, that, and the other, and the idea that a 90-year-old is going to download some software and install it on a 500 half-kilo headset and put that on twice a day and test their vision at home it's just not really realistic. But it's quite hard to justify doing anything better when people think that is going to work and that's good enough. So I was quite struck by that, and I was quite pleased to see someone saying something that was a bit more realistic, a bit more pragmatic. So that's me.
Yeah, you don't need a sledgehammer if just a traditional hammer will do, and thinking about the populations that you're working with is really critical. So much technology is being designed without older adults in mind, and not understanding the physical, the cognitive changes that go on across the life course. It's a real problem. And so if you want, John, you said you're having issues, with people not wearing the tracker that you have. You have to think about those design issues, but you have to think about people's everyday circumstances too. Is it realistic? If given their environment, given who they interact with on a daily basis, given their socioeconomic status, as John indicated, many of the technologies that are being created today are very expensive. I look at my iPhone, which is probably a year and a half old now. Oh my gosh, I grew up as an incredibly poor kid. There is no way that my parents could have afforded, a $1,000 phone. It's ridiculous. And so we have to think about these larger societal structures and inequalities that exist, because it definitely impacts both the technologies that can be designed or should be designed and how they can be implemented in the real world. If we really want to see an impact, we have to take these things into consideration. So, Pete, I'm glad you brought up, those issues, and John too, for that matter. Bowie, your camera's on. Do you want to say anything about who you are and why you came to the session today? And I probably butchered your name, so I am very sorry.
Hi, this is Boy Mang Lian. Actually, I'm originally from Myanmar. Currently, I'm living in the United States to study doing my master's degree at Brandeis University. So back in my home country, I used to work as assistant director in national health policy formulation. So as you all know that Myanmar is now currently at the crisis of COVID and a lot of COVID and political turmoil. So I'm not sure that how the policy and the situation in health sector will restore in near future or not. But however, continue my study. Maybe one day I can contribute back in my home country. So I'm sorry that I joined a little bit late because of my miscalculation of timing. So apology for that.
Thank you for joining us. And, I hope that maybe some of the connections you'll make through the conference will, help you in terms of your future career and have an impact in your country. So it looks like Paul just jumped off. I was going to ping him next since he had not told us who he was. But I think we only have about 3 more minutes. Is that right, Michelle? So what would you like to talk about in your last 3 minutes? I mean, we can certainly talk about, barriers to using technology. We can talk about other things related to technology, but I'm going to throw it open to y'all since we've only got a few more minutes.
I'll just jump in. Thank you so much. I joined because I think I mentioned it before. It was just intriguing how to use technology to increase the connections and the way we provide better care. At the John A. Hartford Foundation, one of our huge initiatives is age-friendly health systems. I mentioned the 4 M's, and mobility is one, medications, making sure people are not on harmful medications, mentation, which would be cognitive health and mood, but also the first M and the most foundational is what matters to older adults, and just asking what matters. And I've heard some good conversation here today thinking about how to first ask what matters, and then use technology to support that, and also make it easy. I feel like there's great high tech, but there's no human that's walking people through. I mean, I just got pinged that our Apple devices must be updated because of Pegasus. Have y'all heard that urgent thing today? But I had to unpair my Apple Watch to then do this and do that. And even I don't have the patience. So I know that older people who aren't as familiar with technology need that support. So first asking what matters, how do you want to use this? What would help you? What kind of design ideas would you like? And then just having a helpline, a human to call to walk you through any of these things, computer, television, assistive devices and wearables. So I really appreciate the work you've done, and thank you for letting me join today and just add that little emotion.
Yeah, thank you, Nancy. Very important points.
Yeah, Nancy, I would add that I think that there's a lot of startups that are, or bigger companies that are working on this, and the ones that are most successful are going to be the ones who sit down with users and get that user experience and nail that, especially early on. I've learned that through going through the National Science Foundation I-Corps program. You have to sit down with people and understand what their problem is, instead of being I don't want to generalize, but a young startup and say, hey, I think I know what they actually do, and building it, and then like getting too far down the road and then figuring out, no, that's not really what their problem is. So starting early and then iterating, doing those user interface, kind of discussions.
Yep, definitely a great point. Michelle, I think we're about out of time. Is that correct?
Actually, I was going to jump in and say this is actually scheduled to 10:30. So we.
Oh, okay, great.
Yeah.
All right. Well, we've got 5 more minutes. I will say, going to John and Nancy's point, human-centered design is really critical. And Clemson, for example, harping my own university here, we have fabulous researchers who are, very much taking that to heart, and that's their specialty, and really helping to think through how can you work with potential users to ensure that whatever technology is being designed is going to be designed with them and for them, and sometimes by them too. So thinking about all those phases of iteration.
Can I offer a counterpoint about the whole issue of human-centered design? I mean, I think it's very true that it is very important. I mean, supremely important in the long run. I suppose as an academic, which is who I am, I find it hard to find any benefit to working on the human-centered design. You can get very good data with a very bad product by just sitting down, cherry-picking the right people, making sure that you hold their hands a lot, you give them extensive training, you personally go around to their house and plug it in for them. I mean, none of these things are scalable, and none of them are sustainable, but you can get a good publication, you can get good data at the end of it, and you can get a good publication, and that's the only mechanism for reward. And so you could spend a lot of time making something that's really usable, but you don't get a lot of benefit from that until you get into quite a late stage, until you're actually kind of commercializing. But by then it's too late. You're not going to get to that stage because you've spent all your time, you don't have the publications because you spent all your time refining the product. So I'm at a sort of stage where I'm kind of trying to work out how do you strike that balance, and how much, how can you get reward? How can you leverage some benefit to spending that time improving the usability, and how can you evidence the usability, and how can you generate publications based on assessing usability? And I just don't know. So I suppose that's why I'm asking.
Anybody want to chime in? Or I can offer a few points, but I don't want to dominate.
Peter, I would agree. I think that depending upon what your goals are, I've talked to researchers who will absolutely not use an Apple Watch or a consumer grade device for research. They need to use actigraphs, or they need to use something that is clinically validated for their research. They can't even write a paper if they're not getting, certain data from a certain device. So it just really depends on what your goals are. I think there's a place for doing HCI, and maybe for whatever you're doing, you might not need it, but in the long run, the products are going to be adopted by billions of people. You need to have that user interface to really nail down seamless integration. As Nancy was just saying, the upgrades, you don't want a person having to do anything. It's just, hey, it does it in its background, and how do we figure that out? Because we did HCI, iteration. So there's always different avenues for collecting data and need to do the UX UI.
And Pete, you're a faculty member, I think from what you said earlier. I mean, you do have the constraints of the system within which you work that you have to operate. So I'm not sure whether you're in a tenure track position or if that even exists at your university. But if it is, like here in the US, we have, publications and presentations and teaching and service and all these things, these metrics that we have to meet before we can move to the next level in the hierarchy of the university. And so, you have to balance those things, and to to take the time to do the research to make sure that you are designing a good tool is time intensive. One of the things that I've done over the course of my career that I found to be particularly beneficial is to work in teams. And so there are some people that are focused on the design. There are some people that are focused on doing the user research. There are some people that are focused on how do we get money to scale this to the next thing. You're still working as part of one integrated team, but dividing and conquering can sometimes help you to achieve more than if you're working, in your lab with your students or your postdocs. So think about adding some other collaborators if you don't have them. That may help a little bit, but it's still time intensive to really do the work that you need to do, to make sure that you're designing it in a way that's people are going to use it. Otherwise, why waste your time designing it? How many, and John, you may have data on this, how many startup companies or how many people that start creating new technology tools never make it to market?
Oh, tons of them.
Yeah,
but there's so many different reasons.
Right.
I look at the segment, that we're working in dementia. There are so many products. I've been in this space for more than 4 years, and I still learn about companies that are building stuff. They're trying to build their own hardware and competing with Fitbit and Apple. And I'm like, there's so many, and they don't make it because they don't have the UX UI. Or they just can't get enough funding to build a product or market it. There's so many different reasons.
Yeah. And, here in the US, NSF and the National Institutes of Health have SBIR technologies or funding mechanisms that help, faculty and startups to try to move those products along the pipeline so that eventually they can be successful. But I can tell you from sitting on, different review panels, like to see the amount of work that goes into even, getting to the point where you're able to apply for one of those funding mechanisms, is still very intensive. And so, I think the stats like 90% or more of products never make it to market. So, what's your goal? Is it to make it to market? Is it to, be able to use in the community at a small scale level? All these things go into, the decisions that you make. So it's a long, hard road. I don't think we should give up trying to make products better or to design new products or, to work with existing products that could be made better. Other thoughts, comments? It looks like we're over time now, Michelle. Should we wrap it up?
Yes, if you could please wrap it up. I just made you the co-host because I'm going to jump to my next session, but feel free to wrap it up here. And I hope you all will join one of the next breakout sessions. But thank you.
Thank you. Yep. Thank you, Michelle. And thank you all for